Physician mocks nurse in front of colleagues. But the hospital director heard everything. The hallway at Mercy General Hospital was busier than usual that Tuesday morning. Nurses rushed back and forth, doctors discussed complex cases in groups, and the sound of equipment created a symphony familiar to all who worked there. Jennifer Wilson was holding the tray with medications when she tripped over her own shadow. Dr. Michael Thompson saw the scene and didn't miss the opportunity. With a nasty smile on his face, he pointed at the young nurse who was trying to pick up the bottles scattered on the floor. "Would you look at that, everyone?" he shouted loudly so everyone in the hallway could hear. "Our star nurse can't even carry a tray without dropping everything." The laughter started quietly, but Michael wasn't satisfied. He approached Jennifer, who was still crouched down trying to gather the medications. "Can you even tell one pill from another? Or do I need to draw you a picture?" he continued, provoking more nervous laughter from his colleagues. Jennifer felt her face burn with shame. Her hands trembled as she tried to organize the medications back onto the tray. She had worked at that hospital for almost 2 years and had never been in such a humiliating situation. "Doctor, it was just an accident," she murmured without looking up. "An accident?" Michael laughed even louder. "That's 3 times you've dropped things this week. Maybe you should consider a career change. How about working in a store? At least if you break something there, you won't kill anyone." What none of them knew was that Dr. Richard Parker, the hospital director, had just stepped out of his office at that exact moment to retrieve a report he had forgotten at the reception desk. He stopped at his office door upon hearing the laughter and Michael's loud voice echoing down the hallway. Richard watched the scene silently. He saw how Jennifer tried to stay strong, how the other staff looked at the floor with second-hand embarrassment, and most of all, how Michael seemed to enjoy the young woman's distress. "You know," Michael continued, now addressing everyone, "I'm impressed how some people even manage to pass nursing school. The exam must have been really easy, wasn't it, Jennifer?" Jennifer finally managed to gather all the medications. She stood up slowly, with tears in her eyes that she fought hard not to shed. Her voice was shaky when she finally replied. "Dr. Michael, I graduated with honors from college. I have 2 years of experience here, and I have never made a serious mistake with a patient." "Oh, of course." Michael clapped his hands exaggeratedly. "The perfect nurse. What a shame that perfection doesn't include being able to walk without tripping." It was at that moment that Richard decided he had seen enough. He started walking toward the group, but before he reached them, Jennifer ran off toward the restroom. Her tears finally began to fall. Michael kept laughing and making comments to his colleagues, completely unaware that his boss had witnessed the entire scene. Richard made a mental note and returned to his office, deciding it was time to look more closely into the behavior of some doctors in his hospital. Dear listener, if you are enjoying the story, please take a moment to like the video and most importantly subscribe to the channel. It's a great help to us who are just starting out. Now continuing. In the women's restroom, Jennifer locked herself in one of the stalls and cried for a few minutes. She couldn't understand why Michael treated her that way. Ever since he had arrived at the hospital 6 months ago, her life had become a living hell. Jennifer was 28 years old and had worked very hard to get to where she was. She came from a simple family in Rochester, in the state of New York, and had gotten a scholarship to study nursing in New York City. Her parents, Mrs. Rose and Mr. John, had made many sacrifices to support her dream. When she got the job at Mercy General Hospital, considered one of the best in the city, Jennifer thought she would finally have the stability she had been looking for. The first few months were wonderful. She got along well with all her colleagues, the patients adored her, and she even received praise from other doctors. Everything changed when Dr. Michael Thompson was hired. In the very first weeks, Jennifer realized he had a difficult personality. Michael was arrogant, treated the nurses as if they were his personal servants, and always found something to criticize in others' work. But with Jennifer, the situation was different. It seemed like Michael had a personal vendetta against her. Every time she was around, he found a way to humiliate her in front of her colleagues. After composing herself in the restroom, Jennifer went back to work. She had patients to care for and couldn't let her personal problems interfere with the quality of her care. That had always been her work philosophy. Her first stop was room 312, where Mr. Harold, a 70-year-old man recovering from heart surgery, was staying. Jennifer always had a special affinity with older patients. "Good morning, Mr. Harold. How did you sleep?" she asked, checking his vital signs. "Oh, my dear Jennifer," the elderly man replied with a smile on his face. "I slept much better after you came last night to give me the pain medicine. You have a special way of taking care of us. I'm happy to hear that. I'll check how your surgery site is doing, and then I'll bring your breakfast." While Jennifer was examining Mr. Harold's bandage, Michael appeared in the doorway. He was making his morning medical rounds, and it was the turn of Jennifer's patient. "Good morning, Mr. Harold," said Michael, completely ignoring Jennifer. "How are you feeling today?" "Doctor, I'm doing very well. This nurse here," he pointed to Jennifer, "has been taking very good care of me. She's an angel." Michael looked at Jennifer with contempt and then turned his attention back to the patient. "Mr. Harold, I need to examine your bandage." "Nurse Wilson," he said her name with disdain, "could you get out of my way?" Jennifer moved aside but stayed in the room to assist with whatever was needed. It was hospital protocol for a nurse to accompany the doctor's rounds. Michael began examining the patient but purposely bumped into Jennifer several times as if she were getting in the way of his work. "Nurse, could you be more aware of where you're standing?" he said loudly. "Isn't it enough that you drop things in the hallway? Now you're interfering with medical care too." Mr. Harold was confused by the comment. He looked at Jennifer, who was clearly uncomfortable, and then at Michael. "Doctor, with all due respect, this young lady has never gotten in my way. On the contrary, she has been very careful and attentive to me." Michael quickly finished the examination and left the room without saying goodbye to anyone. Jennifer stayed there, making sure Mr. Harold was comfortable after the visit. "My dear," said the elderly man, taking her hand, "that doctor isn't being very kind to you, is he?" Jennifer smiled sadly. "Don't you worry about me, Mr. Harold. The important thing is for you to get better quickly so you can go back home to your family." "You remind me of my granddaughter," he continued. "She's also a nurse. She works over in Pittsburgh. I always tell her that being a nurse is one of the most important professions in the world. You all take care of us when we are at our most fragile." Mr. Harold's words brought a little comfort to Jennifer. At least some patients recognized her work, even if her doctor colleague didn't. Meanwhile, Richard was in his office analyzing the staff performance reports. He had asked his secretary, Mrs. Barbara, to bring some specific information about the medical team's behavior. Richard was 52 years old and had been running Mercy General Hospital for over 10 years. He had built his career on solid principles of mutual respect and teamwork. For him, a hospital only worked well when all professionals worked in harmony. In recent months, however, he had noticed a change in the work environment. Some nurses seemed more tense, some doctors more arrogant, and the overall atmosphere wasn't the same anymore. "Mrs. Barbara," he called to his secretary, "could you come here a moment?" Mrs. Barbara entered the room. She was a 60-year-old woman who had worked at the hospital for over 20 years. She knew all the employees and always knew when something wasn't right. "Yes, Dr. Richard. I've noticed some changes in the work environment lately. Have you noticed anything different?" Mrs. Barbara sighed. She knew exactly what Richard was talking about, but she didn't want to be the one to bring gossip to management. "Doctor, I'd rather not comment on specific employee behaviors." "Barbara," Richard gently interrupted her, "you've known me for years. I'm not asking for gossip. I'm concerned about our team's well-being. If there's a problem, I need to know so I can fix it." Mrs. Barbara thought for a moment before answering. "Dr. Richard, ever since Dr. Michael arrived here, some things have changed. He has a very, let's say, direct way of dealing with the nurses." "Direct how?" "He often makes comments that embarrass the girls, especially with Jennifer. She has cried in the bathroom a few times after her shifts." Richard made some notes on his notepad. "Thank you for your honesty, Barbara. You can go back to your work, and please keep our conversation confidential for now." After Mrs. Barbara left, Richard decided he needed to investigate the situation further. He couldn't allow any employee to be mistreated in his hospital, regardless of their position. That same afternoon, during the evening shift, another incident happened. Jennifer was administering medication to an elderly patient in room 205, when Michael appeared for an unscheduled medical visit. "What are you giving her?" he asked, taking the vial from Jennifer's hands without ceremony. "It's the painkiller you prescribed this morning, Dr. Michael." The patient was in pain. Michael examined the vial and then looked at Jennifer with a mocking expression. "Nurse Wilson, are you sure you know how to read? Because the prescription says to give it every 8 hours, and you're giving it every 6. Jennifer was confused. She was sure she had followed the prescription correctly. She took the sheet from Michael's hands and read it carefully. "Doctor, it says here every 6 hours," she said, showing him the prescription. Michael snatched the paper from her hands and looked again. For a moment his expression changed. He had made a mistake, but he wasn't going to admit the error in front of the nurse. "It doesn't matter," he said, tossing the prescription back to her. "Next time, check with me before giving any medication. I can't trust that you'll understand the prescriptions correctly." The patient, Mrs. Mary, a 75-year-old woman, heard the whole conversation. After Michael left, she called Jennifer over. "My dear, that doctor isn't very polite, is he?" "Mrs. Mary, don't worry about that. How are you feeling? Is the pain better?" "Yes, it's better, thank you." "But I wanted to tell you something." Mrs. Mary held Jennifer Wilson's hand. "I have 5 children, all grown up now, and you remind me of my youngest daughter. She is also very dedicated to her work. You are very kind. No, my dear. I see how you take care of me, how you have the patience to explain everything, how you always ask if I need anything. That is a gift from God. Don't let anyone make you doubt your worth." Mrs. Mary's words touched Jennifer Wilson's heart deeply. At that moment, she realized that no matter how Michael Thompson treated her, she knew the value of her work and how much of a difference it made in the patients' lives. Meanwhile, Richard Parker decided to pay a surprise visit to the hospital floors. He wanted to personally observe the dynamics between the medical and nursing staff. He started on the 3rd floor, where the cardiology patients were staying. That's when he heard a heated argument coming from the main hallway. "Nurse Wilson?" It was Michael Thompson's voice. "Could you explain why room 318 hasn't been cleaned yet?" Richard Parker hid behind a column to observe the scene without being seen. "Dr. Thompson," replied Jennifer Wilson, "room 318 was cleaned this morning after the patient was discharged. It's ready for the next admission." "Then why is there still trash in the bin?" "Doctor, I just checked. The bin is empty and has a new bag." Michael Thompson walked to the room with Jennifer Wilson behind him. Richard Parker discreetly followed them. When they arrived at the room, it was obvious that it was clean and organized. Michael Thompson turned red with anger at being contradicted. He looked for something, anything, to criticize. "And that stain on the floor?" He pointed to a small mark on the flooring. Jennifer Wilson looked where he was pointing. It was a normal pattern in the floor, not a stain. "Doctor, that's part of the floor's design. It's not a stain." "Don't give me excuses," shouted Michael Thompson. "If I say there's a stain, there's a stain. You will clean this floor until it shines, and you will do it now." "But, doctor, I have other patients to care for. Mr. Harold is waiting for his 3 p.m. medication." "Mr. Harold can wait. You will do what I'm telling you to do." Richard Parker had seen enough. He stepped out from behind the column and walked towards the 2 of them. "Good afternoon," he said, making Michael Thompson and Jennifer Wilson turn around in surprise. "Dr. Parker." Michael Thompson tried to hide his nervousness. "I was just supervising the room cleaning." "I see." Richard Parker looked around the impeccable room. "Nurse Wilson, is the doctor correct about this stain on the floor?" Jennifer Wilson looked nervously between the 2 doctors. She didn't want to create more problems for herself, but she also couldn't lie to the director. "Dr. Parker, that is not a stain. It's part of the floor's original design." Richard Parker bent down and examined the spot. He confirmed that Jennifer Wilson was right. "Dr. Thompson," he said, standing up, "can we have a private conversation in my office when you finish your activities here?" Michael Thompson swallowed hard. He knew he had been caught exaggerating, but he couldn't back down in front of the nurse. "Of course, Dr. Parker. I'll be there in a few minutes." Richard Parker nodded to Jennifer Wilson and left. Michael Thompson stood there, not knowing what to do. Finally, he left too, without saying another word. Jennifer Wilson took a deep breath. She didn't know if the situation would get better or worse after that conversation between the two doctors. Dear listener, if you are enjoying the story, please take a moment to like the video and especially to subscribe to the channel. It helps us a lot as we are just starting out. Now continuing. An hour later, Michael Thompson knocked on Richard Parker's office door. His hands were sweating, and he was trying to think of a plausible explanation for what had happened. "Come in, Dr. Thompson, please, have a seat." Richard was sitting behind his desk, with a serious expression on his face. Michael sat down in the chair opposite, trying to maintain his composure. "Dr. Michael, I would like to speak with you about some aspects of teamwork here at the hospital." "Of course, Dr. Richard. I am always willing to improve my performance." "Excellent. First question, how do you assess the relationship between the medical team and the nursing team?" Michael thought quickly before answering. "I believe we have a good professional relationship. Obviously, sometimes it is necessary to be firmer to maintain the hospital's quality standards." "I see. And do you consider your supervision methods to be aligned with the hospital's philosophy?" "Absolutely. I believe in excellence, and I do not accept mistakes that could compromise patient care." Fernando made some notes on his notepad. "Dr. Michael, could you give me a specific example of a serious mistake made by Nurse Wilson?" The question caught Michael off guard. He tried to think of a concrete example, but realized he didn't have one. "Well, she has some problems with motor coordination, as we saw today when she dropped the medications." "And did that directly affect the care of any patient?" "Not directly, but it could have." "I see. And what about her technical performance? Any errors in medication, incorrect procedures, lack of knowledge?" Michael was silent for a few seconds. The truth was that Jennifer had never made any serious technical errors. In fact, she was one of the most competent nurses he had ever seen. "Dr. Richard, if I may be frank, I think I am sometimes too much of a perfectionist. Perhaps I have been a bit hard on her." "I appreciate your honesty, Dr. Michael. What worries me is not the perfectionism, but the way that perfectionism is communicated." Richard stood up and went to the window of his office. "In this hospital, we have a very clear policy about mutual respect among staff. Regardless of hierarchy, everyone deserves to be treated with dignity." Michael began to sweat even more. He knew where this conversation was heading. "Dr. Richard, I have never disrespected any employee." Richard turned to face him. "Dr. Michael, I personally witnessed at least 2 situations in the last few hours where you humiliated Nurse Wilson in front of colleagues and patients. I was just... You were just demonstrating behavior incompatible with the values of this institution." Richard went back to his chair and sat down. "Dr. Michael, you are a competent doctor. Your technical skills are undeniable, but technical skill is not enough for teamwork. What do you suggest I do? First, you will apologize to Nurse Wilson. Second, you will participate in an interpersonal relationship training that our human resources team offers. Third, any new complaint about your behavior will result in more severe disciplinary measures." Michael swallowed hard. He had no choice but to accept. "I understand, Dr. Richard. I will follow your guidance." "Excellent. You may leave." "And Dr. Michael?" Richard called out when he was already at the door. "Yes?" "Remember that a good doctor is not only one who cures diseases, but also one who treats people with respect." After Michael left, Richard remained thoughtful in his office. He knew he had given the young doctor a chance to redeem himself, but he also knew he needed to keep an eye out to see if there would be real changes in his behavior. That night, Jennifer was finishing her shift when she ran into Michael in the hallway. She tried to avoid him, but he called her. "Nurse Wilson, may I speak with you for a moment?" Jennifer stopped, expecting another humiliation. But to her surprise, Michael seemed different, more humble. "Nurse Wilson, I would like to apologize for my behavior today and over the past few months." Jennifer was so surprised she didn't know what to say. "I know there's no excuse for the way I treated you. It was unprofessional and disrespectful. Dr. Michael, Please let me finish. I admire your work with the patients. They like you, they trust you, and that's something you can't learn in medical school. It's a gift." Jennifer was still processing what she was hearing. "I hope we can start over, with more mutual respect." "Thank you, Dr. Michael. I accept your apology." The two stood in silence for a moment before going their separate ways. In the following days, there was a noticeable change in Michael's behavior. He was still demanding and a perfectionist, but he was no longer disrespectful. His criticisms were constructive, and he even began to publicly acknowledge Jennifer's good work. Jennifer, in turn, began to feel more confident at work. Without the constant stress of humiliations, she was able to focus better on her activities, and even suggested some improvements to the nursing procedures. Richard observed everything from a distance, pleased with the change in the work environment. But he didn't know there would be more twists in this story. 3 weeks after the incident in Richard's office, an unexpected event completely changed the dynamic between Michael and Jennifer. It was a rainy Thursday afternoon when an ambulance arrived with an emergency case. A man about 50 years old had suffered a heart attack and was in critical condition. Michael was the cardiologist on call and was immediately summoned to attend to the patient. Jennifer was part of the nursing team that would assist. When the patient arrived at the hospital, Michael began working quickly, but something was different. His hands were trembling slightly, and he seemed more nervous than usual. "Nurse Wilson," he called, "I need you to prepare 20 milliliters of morphine." Jennifer looked at him strangely. The dose seemed very high for that type of situation. "Doctor, are you sure? Wouldn't it be better to start with 10 milligrams? Michael stopped what he was doing and looked at her with irritation. "Nurse, I am the doctor here. Prepare what I asked for." Jennifer hesitated. Her experience told her that dose was dangerous, but she didn't want to create a conflict during an emergency. "Dr. Michael," she tried again, "the patient's blood pressure is already very low. A high dose of morphine could make the situation worse." "Nurse Wilson," shouted Michael, completely losing his composure. "Prepare the medication now." Everyone in the emergency room stopped to look. Jennifer realized something was very wrong with Michael. His eyes were glazed over, and he was sweating excessively. It was then that she made a decision that would change everything. Instead of preparing the medication Michael had asked for, she discreetly prepared the dose she thought was correct and signaled to another doctor in the room. Dr. Henry Mitchell, a more experienced doctor, noticed Jennifer's signals and approached to see what was happening. "Michael," he called, "are you all right?" Michael looked at Henry without being able to focus properly. I'm fine. I need the medication." Henry immediately realized something was wrong. Michael was clearly under the influence of some substance. "Michael, let me take over this case. You need to rest." "No." Michael became agitated. "I can take care of my own patient." At that moment, Jennifer made another courageous decision. She approached Henry and whispered, "Dr. Henry, he asked for 20 milligrams of morphine. I prepared only 10 milligrams. Henry looked at her with approval, and then at Michael with concern. "Michael, you are removed from this case. Nurse Wilson, continue with the standard protocol." Michael tried to protest, but Henry was firm. With the correct treatment, the patient was stabilized and taken to the ICU. After the emergency, Henry called Jennifer in private. "Nurse Wilson, what you did today saved that patient's life. If Michael had administered the dose he wanted, the consequences could have been fatal. Dr. Henry, I didn't want to disrespect Dr. Michael, but you did exactly what you were supposed to do. A good healthcare professional knows when to question an order that could harm a patient." That evening, news of what had happened reached Richard's ears. He immediately called a meeting with Henry to better understand the situation. "Dr. Henry, I need you to tell me exactly what happened this afternoon." Henry reported all the details, including Michael's strange behavior and Jennifer's proactive attitude. "And what is your assessment of Dr. Michael's state?" "Richard, I suspect he was under the influence of some substance, perhaps anxiety medication or something stronger." Richard was silent for a few minutes, processing the information. "Thank you for your honesty, Henry. I will take the necessary measures." The next morning, Richard called Michael into his office. The young doctor looked more downcast than ever. "Dr. Michael, I need to speak with you about yesterday's incident." "Dr. Richard, I can explain. First, let me make it clear that Nurse Wilson saved a patient's life yesterday. If she had not questioned your medical decision, we could have had a tragedy." Michael lowered his head. "Second," Richard continued, I need to know what is happening with you. Your behavior over the last few months, culminating in yesterday's episode, indicates that something is wrong." Michael was silent for a few minutes before answering. "Dr. Richard, I've been going through some personal problems." "What kind of problems?" Michael sighed deeply before speaking. "My parents are getting divorced after 25 years of marriage. My mother discovered my father has been having an affair for years. She is devastated and has been calling me every day crying." Richard listened patiently. "Besides that," Michael continued, "I've been having trouble sleeping and I started taking anxiety medication. Yesterday I took a larger dose because I was particularly nervous. Dr. Michael, why didn't you come to me sooner to talk about this? I thought I could handle it alone. I didn't want to seem weak or incompetent." Richard stood up and went to a small refrigerator in his office, taking out 2 bottles of water. "Michael," he said, offering one of the bottles, "strength is not pretending everything is fine when it's not. Strength is asking for help when you need it. What will happen to me now? First, you will take a medical leave for a few weeks. Second, you will seek psychological help. Third, when you return, you will work under supervision until I am sure you are well." Michael nodded in agreement. "And Dr. Michael?" Richard called out as he was getting up to leave. "Yes? When you return, I want you to work especially with Nurse Wilson. She showed yesterday that she has excellent clinical judgment. You can learn a lot from each other." After Michael left the room, Richard reflected on how personal problems can affect the work environment. He decided it was time to implement some changes at the hospital to better support the emotional well-being of all staff. That afternoon, Richard called a meeting with the entire medical and nursing team. He wanted to talk about the incident from the previous day and take the opportunity to make some important announcements. "Colleagues," he began, "yesterday we had a situation that taught us some valuable lessons about teamwork and communication." Everyone was paying attention, especially Jennifer, who was still processing everything that had happened. "Nurse Wilson demonstrated yesterday what it means to be a true healthcare professional. She questioned a medical decision when she realized it could harm a patient, and in doing so, she saved a life." Some colleagues looked at Jennifer with admiration, others with surprise. This made me reflect on the importance of having a team where everyone feels comfortable questioning, suggesting, and contributing, regardless of hierarchy. Richard paused before continuing. "Because of this, I am announcing some changes to our internal policy. First, we will implement a psychological support program for all staff. Second, we will create a confidential channel for reporting interpersonal relationship problems. Third, we will promote regular training on teamwork." Jennifer felt emotional seeing that her experiences were leading to positive changes for everyone. "And finally," said Richard, looking directly at her, "I want to announce that Nurse Wilson will be promoted to nursing supervisor for the afternoon shift, recognizing not only her technical competence, but especially her leadership and clinical judgment." The auditorium applauded. Jennifer was so surprised she couldn't speak. Tears of joy began to stream down her face. After the meeting, several colleagues approached to congratulate Jennifer. She was still in shock about the promotion. Mrs. Barbara, Richard's secretary, approached her with a smile on her face. "Congratulations, dear, you really deserve this promotion." "Thank you, Mrs. Barbara. I still can't believe this is happening." "Oh, you better believe it, and let me tell you a little secret, Mrs. Barbara lowered her voice. "Dr. Richard has had his eye on your work for months. He always tells me how dedicated and caring you are with the patients." "Really? Really? And it wasn't just yesterday's incident that got you this promotion. It was all your work over these past 2 years." That evening, Jennifer called her parents in Rochester to share the news. "Honey," shouted Mrs. Rose over the phone, "what joy! I always knew you would go far." "Mom, I still can't believe it. Just a few weeks ago I was thinking about giving up and now you've become a supervisor," completed Mr. John, who had picked up the other phone. "We are so proud of you. Dad, Mom, thank you for never doubting me, even when I doubted myself." "Honey," said Mrs. Rose, "sometimes life puts us in difficult situations to prepare us for better things. What you went through with that doctor was bad, but it made you stronger." Her mother's words made a lot of sense to Jennifer. Truly, all the suffering of the last few months had contributed to her personal and professional growth. Dear listener, If you are enjoying the story, please take a moment to like the video, and especially to subscribe to the channel. It really helps us who are just starting out. Now continuing, 3 weeks later, Michael returned to the hospital. He had undergone psychological treatment and seemed like a completely different person, calmer, more humble, and visibly healthier. Richard received him in his office for a conversation before he resumed his activities. "How are you feeling, Dr. Michael?" "Much better, Dr. Richard. The treatment helped me understand many things about myself that I didn't want to see." "What kind of things?" "For example, that I was taking out my personal frustration on my colleagues, that I was using my medical authority incorrectly to feel superior, and most importantly, that I was harming the work itself by creating a toxic environment." Richard was pleased to hear these reflections. "And how do you plan to apply these lessons in your daily work?" "First, I want to formally apologize to the entire team, especially to Supervisor Wilson. Second, I want to learn to work in a more collaborative way. Third, I will continue therapy so I don't regress." "Excellent. And about working under supervision?" "I completely accept it. In fact, I think it would be good to work especially with Supervisor Wilson. She showed a clinical judgment that I would like to understand better." Richard smiled. The change in Michael was remarkable. "Very well. You can start on Monday. Supervisor Wilson will guide your reintegration." On Sunday evening, Jennifer was at home mentally preparing herself to work with Michael again. She was nervous, despite all the changes that had happened. She lived in a small but cozy apartment in the East Village neighborhood of New York City. It was a space she had decorated with great care, using her savings to create an environment that made her feel at home. While preparing dinner, Jennifer reflected on how her life had changed drastically in just a few weeks. From a humiliated nurse, she had become a supervisor. From a victim of bullying, she had become a team leader. On Monday morning, Jennifer arrived at the hospital earlier than normal. As a supervisor, she now had additional responsibilities and wanted to get organized before meeting Michael. At 8 o'clock sharp, Michael appeared in the nursing supervision office. He knocked on the door and waited to be invited in. "Good morning, Supervisor Wilson." "Good morning, Dr. Thompson. Please have a seat." The two sat in silence for a few seconds, processing the strange role reversal that was taking place. "Supervisor Wilson," Michael began, "first of all, I would like to formally apologize for my behavior over the past few months. There is no excuse for the way I treated you. Thank you for the apology, Dr. Thompson. I accept it and suggest we move forward." "I agree. How would you like us to structure our work?" Jennifer had thought a lot about this question over the weekend. "Dr. Thompson, your technical experience is unquestionable. What we need to work on is communication and teamwork. I suggest that for the first few weeks you observe not only the medical procedures, but also how we interact with patients and the rest of the team." A perfect suggestion. I am willing to learn. And so began a partnership that no one could have predicted just a few weeks before. In the first few days, Michael observed Jennifer working. He was impressed with how she communicated with patients, always explaining procedures clearly and caringly. "Supervisor Wilson," he asked one afternoon, "how did you learn to have so much patience with patients?" "Dr. Thompson, I think it comes from my personal experience. When my grandmother was in the hospital before she passed away, I was just a teenager. But I noticed how the way she was treated made a difference in her well-being." "I see. You had a personal inspiration for choosing nursing." "And you? Why did you choose medicine?" Michael was thoughtful before answering. "To be honest, it was family pressure. My father is a doctor. My grandfather was a doctor. It was expected that I would follow the tradition." "But do you like what you do?" "Yes, I do. But I think I lost focus along the way. I started to worry more about status and recognition than about caring for people. This conversation marked the beginning of a mutual understanding between the two professionals. In the following weeks, Michael began to show a genuine change in his behavior. He was polite to the entire team, publicly acknowledged his colleagues' good work, and even started asking for suggestions before making important decisions. Jennifer, in turn, began to respect Michael's technical skills and learn from his medical experience. She realized that behind the arrogance there was a very competent professional. 1 month after Michael had returned, another emergency case occurred that would test the new dynamic between them. It was a Friday afternoon when a 25-year-old woman arrived with symptoms of poisoning. She was unconscious, and her family couldn't say what had happened. Michael was again the doctor on duty, and Jennifer was part of the care team. But this time the situation was different. "Supervisor Wilson," Michael said as soon as the patient arrived, "I need your assessment of the symptoms." Jennifer was surprised by the request. A few months ago, Michael would never have asked for her opinion. "Dr. Thompson, given the neurological symptoms and the dehydration, I would suspect poisoning by some chemical substance." "That's my suspicion too. What tests do you suggest?" "I believe we should do a full toxicology screening and also check liver and kidney functions." "Perfect. Let's work together on this case." For the next 2 hours, Michael and Jennifer worked as a true team. He used his medical experience to interpret the tests and make treatment decisions, while she used her observation and communication skills to gather important information from the family. It was Jennifer who discovered, by talking to the patient's sister, that she had started using a new cleaning product at home 2 days before. This information was crucial for Michael to identify the type of poisoning and apply the correct treatment. The young woman was saved and made a full recovery. After the case, Michael sought out Jennifer. "Supervisor Wilson, I wanted to thank you. Without your contribution, I probably wouldn't have discovered the cause of the poisoning in time. Dr. Thompson, we worked as a team. It was a joint effort." "Exactly, and that's how it should always be." At that moment, the two realized they had developed not only mutual respect, but also a genuine admiration for each other's skills. Richard, who had followed the case from a distance, was extremely pleased to see the transformation in the relationship between the two professionals. That night, he wrote in his personal diary, "Today I witnessed something that filled me with pride. 2 professionals who just a few months ago were in constant conflict worked together in an exemplary way to save a patient's life." Michael learned to value the knowledge and experience of other professionals. Jennifer showed leadership and technical competence that go far beyond her nursing training. They have become an example of what is possible when we overcome pride and prejudices. 2 months later, Mercy General Hospital received an inspection visit from the City Health Department. It was a routine evaluation, but one that could result in important certifications for the hospital. The team of inspectors was impressed with the collaborative work environment they found. They especially highlighted the partnership between doctors and nurses and the patient's satisfaction with the care. "Dr. Parker," said the head of the inspection team, "we rarely see a hospital where there is so much harmony among the different professionals. How did you manage to create this culture?" Richard smiled as he answered, "I think the secret lies in recognizing that every professional has something valuable to contribute, regardless of hierarchy. And sometimes, the best changes come from the most difficult moments." Mercy General Hospital received an excellent certification in people management, being recognized as an example of good practices in a hospital work environment. At the certification award ceremony, Richard made a point of highlighting the role of Jennifer and Michael in the hospital's transformation. This certification wouldn't be possible without professionals like Supervisor Jennifer Wilson and Dr. Michael Thompson, who showed that it's possible to turn conflicts into opportunities for growth. Jennifer and Michael were in the front row, side by side, as symbols of the change that had happened at the hospital. After the ceremony, the two walked together down the hallway where it had all begun a few months earlier. "Supervisor Wilson," said Michael, "do you remember that day when I humiliated you for dropping the medications?" "Of course I remember, Dr. Michael. I wanted you to know that was one of the worst moments of my professional career, not because of the situation itself, but because of the kind of person I was becoming. And I want you to know that moment, as painful as it was, taught me a lot about resilience and about not giving up on my dreams." "You know what else amazes me?" said Michael, stopping walking. "After everything I did, you were still able to give me a second chance." "Dr. Michael, everyone deserves a second chance, especially when they show a genuine desire to change, as you did." The two continued walking in silence for a few minutes, each reflecting on the journey they had shared. "Supervisor Wilson," said Michael. "May I ask a personal question?" "Of course." "How were you able to forgive everything I did? Because I know the forgiveness wasn't just professional. You genuinely forgave me as a person." Jennifer thought carefully before answering. "Dr. Michael, during those difficult months, I learned something important about myself. I discovered that holding on to anger and resentment only hurt me. When I realized you were going through personal problems, I understood that your attitude wasn't about me. It was about your own pain. You are a very special person, Supervisor Wilson." "No, Dr. Michael. I'm just a person who believes that we can all change and grow, including myself." 6 months later, Mercy General Hospital was organizing its first symposium on healthcare humanization. The event would bring together professionals from various hospitals in the city to share experiences and best practices. Richard invited Jennifer and Michael to present a case study together on transforming conflict in a hospital environment. "You two are the perfect example of how interpersonal problems can be turned into opportunities for growth," he said during the invitation. The night before the presentation, Jennifer and Michael met to make the final adjustments to their talk. "Supervisor Wilson," said Michael, "I have a confession to make." "Go ahead, Dr. Michael." "When I first started working here, I felt intimidated by the competence of some professionals, especially experienced nurses like you, but instead of admitting it and trying to learn, I chose the path of arrogance to protect myself." "I understand. And how do you feel now?" "Now I feel privileged to work with such competent professionals. I learn something new every day, not just about medicine, but about how to be a better person." "You know, Dr. Michael, your courage to change inspired me too. It taught me that it's never too late to start over and that we all deserve compassion, especially when we are at our most difficult moments." On the day of the presentation, the auditorium was packed. Healthcare professionals from all over the city had come to hear about the Mercy General Hospital experience. Jennifer began the presentation by sharing her perspective of the events. "A year ago, I was just a nurse considering leaving the profession because of a toxic work environment. Today I am the nursing supervisor at a hospital that is a benchmark for humanization." Michael continued, "And I was an arrogant doctor who used his authority to humiliate colleagues, harming not only the work environment, but, most importantly, the quality of patient care." The two took turns during the presentation, telling how the situation had evolved, Richard's interventions, the challenges of the change process, and especially the positive results they had achieved. "What we learned," said Jennifer, "is that interpersonal conflicts in a hospital environment are not just HR problems. They directly affect the quality of patient care. And more importantly," Michael added, "is that these conflicts can be turned into opportunities for growth when there is committed leadership and a genuine desire for change." At the end of the presentation, the audience gave a standing ovation. Several professionals came forward to ask questions and share their own experiences. A nurse from another hospital approached Jennifer. "Supervisor Wilson, thank you for sharing your story. I'm going through something similar at my hospital and was thinking of giving up. Your experience has given me hope." A young doctor addressed Michael. "Dr. Thompson, your honesty touched me deeply. I recognize some of my own behaviors in your story. How can I start to change?" Michael and Jennifer spent over an hour after the presentation talking individually with various professionals, offering guidance and support based on their experience. Richard watched everything with pride. He had made the right decision by giving Michael a second chance and by promoting Jennifer. The two had become not only better professionals but also leaders and mentors for others. 1 year after the first incident in the hallway, Jennifer was in her supervisor's office when she received an unexpected call. "Supervisor Wilson, this is Mrs. Helen, Dr. Thompson's mother." Jennifer was surprised. She had never spoken to Michael's mother. "Hello, Mrs. Helen. How can I help you?" "I would like to speak with you in person if possible. It would be very important to me." "Of course. When would you like to meet?" "This afternoon, if it's possible. May I come to the hospital?" Jennifer agreed, curious to know what Michael's mother wanted to talk about. At 3 p.m., Mrs. Helen arrived at the hospital. She was an elegant lady of about 55, well-dressed, and with a kind look. "Supervisor Wilson, thank you for seeing me." "Not at all, Mrs. Helen. Please have a seat. Would you like some coffee?" "Yes, thank you." The two sat down in Jennifer's office, and she served coffee for both. "Supervisor Wilson," Mrs. Helen began, "I came here to thank you." "Thank me? For what?" "For what you did for my son." Jennifer was confused. "Mrs. Helen, I don't understand." "Supervisor Wilson, Michael told me the whole story. How he treated you poorly for months, how you had patience and professionalism, and most of all how you helped him when he needed it most." Jennifer began to understand where the conversation was heading. "Michael told me that when he was going through problems with anxiety and his parents' divorce, you were the only person who treated him with compassion, even after everything he had done." "Mrs. Helen, I just did what any colleague should do." "No, my dear. You did much more than that. You saved my son's career and possibly his life." Mrs. Helen pulled a tissue from her purse and dabbed her eyes. "When Michael was going through that difficult phase, I didn't know how to help him. He was pulling away from everyone, including his family, but he always talked about a nursing supervisor who had the patience to listen to him and who treated him with respect. He was talking about me. Constantly. He said you were the kind of professional he wished to be. That you treated patients like family, and that you never used your authority to belittle other people." Jennifer was moved to hear those words. "Supervisor Wilson," continued Mrs. Helen, "I came here to ask you a favor." "Of course, go ahead." "I would like to invite you to Ricardo's birthday dinner next Sunday. It will just be close family, but I would very much like you to be there." "Mrs. Helen, I'm honored by the invitation, but I don't know if it would be appropriate. We are work colleagues." "Supervisor Wilson, you are more than work colleagues. You are an example of how people can overcome differences and grow together. That is very rare and valuable." Jennifer thought for a few moments before answering, "All right, Mrs. Helen. It will be an honor to attend Dr. Michael's birthday." The following Sunday, Jennifer arrived at the Thompson family's home in an upscale neighborhood of New York City. It was a large, cozy house, tastefully decorated. Michael greeted her at the door, clearly happy to see her there. "Supervisor Wilson, what a joy that you came. Thank you for the invitation, Dr. Michael, and happy 32nd birthday." "Thank you. Come in. I want to introduce you to the whole family." The house was full of Michael's relatives. Jennifer was introduced as the supervisor who changed my professional life. During dinner, Jennifer spoke with several members of the family. Everyone commented on the positive change they had noticed in Michael over the last few months. "Supervisor Wilson," said Michael's father, an elegant gentleman of 60, "my son told me about your partnership at the hospital. As a retired doctor, I am happy to know that there are still professionals who value teamwork. Dr. Thompson, your son is an excellent doctor. It was a pleasure learning to work with him." "Father," Michael interrupted, "Supervisor Wilson is being very modest. She taught me more about medicine in the last few months than I learned in some years of medical school." "How so?" asked his father, curious. "She taught me that medicine isn't just about diagnoses and treatments. It's about understanding people, working as a team, and most of all about the humility to recognize that we always have something to learn." Jennifer was moved to hear Michael speak that way in front of his family. Later, when some guests had already left, Michael and Jennifer sat in the garden of the house to talk. "Supervisor Wilson, I wanted to take this moment to reflect with you." "Go ahead, Dr. Michael." "Exactly 1 year ago, if someone had told me we would be here, talking as friends and respectful colleagues, I would never have believed it. Neither would I, to be honest. And you know what impresses me the most? The whole process of change started when I was at my worst, when I was publicly humiliating you, when I was making dangerous medical decisions because of the medication, when I was destroying my own career. Sometimes we need to hit rock bottom to find the courage to change." "Exactly. And I wanted you to know that you were fundamental in that process, not only for giving me a second chance, but for being a constant example of how a healthcare professional should behave." "Dr. Michael, can I make a confession?" "Of course." "During those difficult first months, there were many times I wanted to give up, not just the job, but the entire profession. I would come home crying and call my mother saying I couldn't take it anymore. Really? I never imagined. It's true. But you know what made me continue? The patience. Every time I thought about giving up, I remembered Mr. Harold, Mrs. Mary, all those patients who trusted in me. And now I feel professionally fulfilled. I'm a nursing supervisor. I work at a hospital I love and I have colleagues I respect and who respect me. Supervisor Wilson, may I say something that might be inappropriate for a professional setting? Go ahead. You have become one of the most important people in my life. Not just as a colleague, but as an example of a human being. You taught me about forgiveness, about second chances, and about the importance of treating everyone with dignity. Jennifer was moved by Michael's words. Dr. Thompson, you have also become very important to me. You taught me that people can genuinely change when they have real motivation to do so. The two remained silent for a few minutes, appreciating the garden illuminated by the full moon. Supervisor Wilson, said Michael, I have a proposal to make. What kind of proposal? I would like us to become partners on a project I'm developing. What project? I want to create a mentorship program for healthcare professionals who are experiencing interpersonal difficulties at work, based on our experience. Jennifer became interested. How would it work? The idea is to offer support both to professionals who are victims of workplace bullying and to those who recognize they need to change their behavior, a kind of professional mediation. That's a very interesting idea. And how would I fit into this? You would be my partner in coordinating the program. Your experience as a victim who knew how to forgive and lead, combined with my experience as an aggressor who managed to transform, would be perfect for helping other professionals. Jennifer was excited by the idea. Dr. Thompson, I would love to be part of this project. Really? Really? I think we can help many people with our story. And so the Fresh Start Project was born, a pioneering mediation and support program for healthcare professionals in conflict. 6 months later, the Fresh Start Project had already served more than 50 cases in different hospitals in New York City. Michael and Jennifer worked together twice a week, offering workshops, mediation sessions, and individual follow-up. The project gained recognition from the City Health Department and even from some universities that began to include the program in their undergraduate medicine and nursing curricula. On a Thursday afternoon, Michael and Jennifer were preparing a presentation about the Fresh Start Project for a national conference on healthcare humanization. Supervisor Wilson, said Michael, have you noticed how our story has become much bigger than we ever imagined? How so? When it all started, it was just about our personal conflict. Now we're helping hundreds of professionals across the country. It's true, sometimes I think it was all part of a greater purpose. You know what else amazes me? Michael continued. Dr. Parker always says that the best transformations are born from the greatest crises. Our story is living proof of that. At that moment, Jennifer's phone rang. It was Richard calling her office. Supervisor Wilson and Dr. Thompson, he said, could you come to my office? I have a surprise for you. The two walked curiously to Richard's office. When they entered, they found a group of people waiting. Mrs. Barbara, Dr. Henry Mitchell, some nurses from the team, and even Mr. Harold and Mrs. Mary, the patients who had marked the beginning of Jennifer and Michael's transformation. What's going on? Asked Jennifer. Please have a seat, said Richard with a smile on his face. Colleagues, he began, you know that today marks exactly 1.5 years since the first incident that started the transformation of our hospital. Everyone nodded in agreement. During this period, we not only resolved an interpersonal conflict, but we also created a management model that is being replicated in hospitals across the country. We've received humanization awards, quality certifications, and most importantly, we've transformed lives. Richard paused to pick up an envelope from his desk. That is why, on behalf of the leadership of Mercy General Hospital and the city's health department, I have the honor to announce that Supervisor Jennifer Wilson and Dr. Michael Thompson have received the National Award for Excellence in Healthcare Humanization. The group erupted in applause. Jennifer and Michael were completely surprised. Furthermore, Richard continued, The Fresh Start project has been selected by the Department of Health to be implemented in public hospitals across the United States. Jennifer began to cry with emotion. Michael was visibly moved as well. "Dr. Richard," said Jennifer, "I don't know what to say." "You don't need to say anything," interrupted Mr. Harold, rising with some difficulty. "Let me speak for all of us, the patients." The elderly man approached Jennifer and Michael. "You two have taught me that a hospital isn't just a place to treat illnesses, it's a place to care for people. And you cared not only for us, the patients, but you cared for each other." Mrs. Mary also stood up. "I wanted to say that you are an example that it's never too late to forgive and start over. At my age, 78 years old, I still learn new things by watching you work." Everyone in the room was emotional. Richard then made the final announcement. "And finally, I am pleased to inform you that the hospital's administrative board has approved the creation of the Jennifer Wilson Michael Thompson Center for Humanization, which will be the country's first center specialized in conflict mediation in a hospital environment." This time Jennifer couldn't hold back the tears. Michael was also crying. "Dr. Richard," said Michael, "when I started working here, I was a completely different person, arrogant, insensitive, and most of all unhappy with myself. And I was an insecure nurse who was considering giving up on my dreams," Jennifer added. "And today," they both continued together, "we are partners in a project that is changing lives across the country." Richard smiled. "Do you know the moment when I knew everything was going to work out?" "Which one?" they both asked. "It was that day of the emergency with the young poisoned woman. When I saw you working together, without ego, focused only on saving the patient. At that moment, I knew you had discovered the true meaning of being a healthcare professional." The meeting ended with a toast of grape juice, since they were in the hospital, and lots of hugs and congratulations. Later, when everyone had left, Jennifer and Michael were alone in Richard's office, processing everything that had happened. "Supervisor Wilson," said Michael, "can you believe all of this?" "To be honest, I'm still processing it. 2 years ago, I never would have imagined my life would take this turn. You know what amazes me most about this whole story?" "What?" "It's that our transformation began at the darkest moment, when I was at my worst behavior and you were in your deepest suffering." "That's true. Sometimes I think it was necessary to reach that point for us to truly grow." "Supervisor Wilson, may I ask a personal question?" "Of course." "Have you ever regretted forgiving me in those early days?" Jennifer thought for a moment before answering. "Dr. Michael, forgiving wasn't a decision I made overnight. It was a gradual process. And no, I have never regretted it, because I saw that the forgiveness transformed not only you, but also me." "How did the forgiveness transform you?" "It taught me that I am stronger than I thought. He taught me about leadership, about how to inspire change in other people, and most importantly, he taught me that we all deserve compassion, including ourselves." "And now? How do you see yourself in the future?" "I see myself continuing this work of transformation. I want our story to inspire other professionals not to give up, whether they are being victims or when they recognize they need to change. And I want to keep learning. I learned more about being a doctor and about being a person in the last 2 years than in my entire previous life." The two fell silent, looking out the window of Richard's office and watching the activity of the hospital. "Supervisor Wilson," said Michael, "there's something I never told you." "What?" "That first day when I humiliated you in the hallway, I saw Dr. Richard observing everything. At the time, I thought he was just passing by. Later, I found out he had left his office exactly at that moment. Do you think it was intentional? Today, I'm sure of it. Dr. Richard is the kind of leader who has a very sharp sense for detecting problems before they become bigger. I think he had been observing my behavior for some time." "That makes sense. He always knew exactly the right words to guide us throughout this whole process." "And you? Is there anything you never told me?" Jennifer smiled before answering. "Yes. In those difficult first months, I used to write letters to you." "What do you mean, letters?" "I would get home at night and write letters saying everything I wished I had the courage to say. I talked about how I felt, about what I thought was causing your behavior, and even about how I thought we could work better together. Really? And what did you do with those letters? I kept them all. I have a box at home with more than 30 letters I wrote to you, but never sent. Michael was moved to hear this. And why did you do that? I think it was my way of processing the situation without feeding anger or resentment. When I put everything on paper, I could see the situation more clearly and less emotionally. Can I ask you something? Of course. Do you still have those letters? I have all of them. Would you let me read them someday? Jennifer thought for a few moments. You know what? Yes. I think it would be interesting for you to understand my perspective during that period, and for me it would be a way to completely close this chapter. Thank you. That would be very important to me. That weekend, Jennifer invited Michael to her house to read the letters. It was the first time a co-worker would visit her apartment, but she felt that Michael had become more than a co-worker. When Michael arrived at Jennifer's apartment on Saturday afternoon, he was impressed by the cozy and personal decoration of the space. Supervisor Wilson, your home is absolutely beautiful. Thank you, Dr. Thompson. Every object here has a special story for me. Jennifer served coffee, and the two sat in the living room. She brought out a decorated box full of handwritten letters. Here are all the letters I wrote to you over those months. Michael picked up the box carefully, as if he were holding something very precious. May I read some now? You may. In fact, I would like you to read them. I think it will be important for both of us. Michael began to read the first letter, dated 1 week after the first incident in the hallway. Dr. Thompson, today was another difficult day at the hospital. I can't understand why you treat me with such contempt, but I've been trying to think if I did something to deserve it. I've reviewed all our encounters and I can't find a reason. I think that perhaps you are going through some personal difficulty and are taking it out on me. If that's the case, I want you to know that I am willing to listen if you want to talk. I believe we all have difficult moments. Michael stopped reading and looked at Jennifer with tear-filled eyes. Supervisor Wilson, you were being humiliated by me and yet you offered support? Keep reading. There are letters from many different times. Michael continued reading. There were letters of venting, where Jennifer told of her tears and her desire to give up. There were letters of reflection, where she tried to understand his behavior. And there were letters of hope, where she imagined what it would be like if they could work well together. One of the letters that touched Michael the most was written after the episode where he almost prescribed the wrong dose of morphine. Dr. Thompson, today I witnessed something that worried me greatly. I saw that you were not well during the emergency. I know I have no right to comment, but as a co-worker, I would like you to know that I recognize your medical competence, and I know something was not normal today. I hope you find help if you need it. We all need help sometimes, and that doesn't make us weak. Supervisor Wilson, said Michael, his voice choked, you saw I was having trouble before I even admitted it to myself. Dr. Thompson, when we work with people every day, we develop a sensitivity to notice when someone is not well. Michael spent over 2 hours reading the letters. Some made him cry. Others made him reflect deeply on his behavior from that period. Supervisor Wilson, he said after finishing all the letters, these letters are an amazing document of compassion and emotional maturity. They were my way of surviving those difficult months. May I make a request? Of course. I would like to include some excerpts from these letters in our book about the Fresh Start project. Of course, only if you authorize it. Book? What book? Michael smiled. That's my new surprise for you. A publisher approached me last week wanting to publish our story. It would be a book about transforming conflict in the workplace. Really? Really? And I would like you to be my co-author. Jennifer was excited by the idea. Dr. Thompson, it would be an honor to write this book with you. And so began another joint project between the two professionals. 2 years later, the book From Conflict to Partnership, a true story of transformation in a hospital environment, became a bestseller in the fields of people management and healthcare humanization. The book told the whole story, from the first conflicts to the creation of the Jennifer Wilson Michael Thompson Center for Humanization. It included excerpts from Jennifer's letters and testimonials from patients, colleagues, and family members. But most importantly, the book inspired the creation of similar programs in hospitals across the United States and even in other countries. On the book launch night, held in the auditorium of Mercy General Hospital, there were over 300 people present: healthcare professionals, hospital managers, students, family members, and even some patients who had followed Jennifer and Michael's journey. Richard opened the event. "Colleagues, we are here to celebrate much more than the launch of a book. We are celebrating proof that human transformation is possible when there is a genuine desire for change and an environment conducive to growth." Jennifer and Michael took turns presenting the book, each telling their perspective of the story. "When I started writing this book," said Jennifer, "I thought it would only be about our personal experience. But during the writing process, I realized our story represents something universal: the human capacity to forgive, grow, and transform." "And for me," Michael continued, "writing this book was a final healing process. It helped me fully understand the impact of my actions and value even more the second chance I received." During the question and answer session, a young nursing student raised her hand. "Supervisor Wilson, what advice would you give to professionals who are going through similar situations to what you experienced?" Jennifer thought carefully before answering. "First, don't give up on your dreams because of other people's behavior. Second, seek support, whether from colleagues, superiors, or specialized professionals. Third, remember that you have value regardless of others' recognition. And finally, always keep your heart open to the possibility of change, both in yourself and in others." A young doctor asked Michael, "Dr. Thompson, how can we identify when our own behavior is harming the work environment?" "Excellent question," replied Michael. "First, let's pay attention to our colleagues' reactions to our behavior. Second, let's ask for honest feedback from people we trust. Third, let's do a regular self-assessment. Am I treating everyone with respect? Am I contributing to a positive environment? And most importantly, are we willing to change when we realize something isn't right?" The book launch evening was a great success. Several people approached Jennifer and Michael to share their own stories of conflicts and transformations in the workplace. 3 months after the book launch, Jennifer and Michael received a special invitation to present their experience at the World Congress on Healthcare Humanization in London, England. It was the first time either of them would travel outside the United States for work. Richard made a point of covering all travel expenses as recognition for the work they had developed. On the plane to London, Jennifer and Michael talked about how their lives had changed in recent years. "Supervisor Wilson," said Michael, "have you ever stopped to think where we would be today if that first conflict hadn't happened?" "I think about that sometimes. I'd probably still be just a regular nurse, and you would be just another doctor. And we would never have discovered our potential to help other people." "That's true. Sometimes I think it was all necessary to prepare us for something bigger." In London, Jennifer and Michael's presentation made a big impact. Professionals from more than 30 countries were interested in the American model for conflict mediation in a hospital environment. After the presentation, they were approached by representatives from hospitals in France, Germany, Canada, and even Japan, all interested in implementing similar programs. "Jennifer and Michael," said Dr. Peter Dubois, director of a large hospital in Paris, "you have created something revolutionary. I would like to invite you to conduct a training session at our hospital." Other similar invitations arrived throughout the Congress. Jennifer and Michael realized their story had transcended geographical and cultural borders. On the last day of the Congress, the two were walking through the streets of London, reflecting on everything that had happened. "Dr. Thompson," said Jennifer, "when I was a child in Rochester, I never imagined that one day I would be walking the streets of London after giving a lecture to doctors from all over the world. And I, who grew up thinking success meant having the most expensive practice and the nicest car, discovered that true fulfillment lies in making a difference in people's lives. You know what impresses me most about our entire journey? What? It's that it started with so much pain and turned into so much joy and purpose. Supervisor Wilson, can I make a confession? You always can. Today I consider you one of my best friends, not just a professional partner, but truly a very important person in my life. Dr. Thompson, I also consider you one of my best friends. And that is very special because we built this friendship through overcoming a very painful conflict. You know what that taught me? What? That the best human relationships are sometimes born from the most unlikely situations. When they returned to the United States, Jennifer and Michael brought back in their luggage not just the international experience, but also invitations to develop humanization projects in several countries. Richard received them with great pride. You have become international ambassadors of American humanization. Dr. Richard, said Jennifer, none of this would have been possible without your leadership and your support from the beginning. And especially, added Michael, without your ability to turn a crisis into an opportunity for growth. Colleagues, replied Richard, you did all the work. I just provided the right environment for the transformation to happen. In the following months, the Jennifer Wilson Michael Thompson Center for Humanization became an international reference. Professionals from various countries visited Mercy General Hospital to learn about the work developed there. The program was adapted for different cultural realities and implemented in hospitals across Latin America, Europe, and even Asia. Jennifer was promoted to Director of Humanization at the hospital, while Michael became the medical coordinator of the Center for Humanization. 3 years after the book launch, the two received another important recognition. They were nominated for the International Award for Innovation in Hospital Management. At the award ceremony, held in New York, Jennifer and Michael were among the finalists from over 200 projects from 50 different countries. When they announced that the American project had won first place, the two hugged emotionally on stage. During the acceptance speech, Jennifer said, "This award represents much more than professional recognition. It represents proof that it is possible to turn pain into purpose, conflict into partnership, and individualism into collaborative work." Michael added, "And most importantly, it represents the hope that our story can inspire other professionals to never give up on the possibility of change, growth, and transformation." When they returned to the United States with the award, they were received as heroes at Mercy General Hospital. The hospital entrance was decorated with congratulations banners, and all the staff were present to welcome them. Richard organized a special ceremony in the hospital auditorium. In addition to all the staff, family members, patients, representatives from the Department of Health, and even journalists from specialized healthcare media were present. "Colleagues," said Richard, opening the ceremony, "today we celebrate not just an international award, but 5 years of continuous transformation in our hospital. 5 years ago," he continued, "we had an interpersonal relationship problem that could have destroyed careers and harmed patients. Today we have a management model that is being replicated in dozens of countries." Richard paused and looked at Jennifer and Michael. "But what makes me proudest isn't the awards or the international recognition. It's seeing two people who knew how to turn their personal difficulties into instruments of help for thousands of other professionals." After the ceremony, when most people had left, Jennifer, Michael, and Richard were alone in the auditorium. "Dr. Richard," said Jennifer, "I would like to reflect on everything we've experienced these years." "Go ahead, Jennifer." "When it all started, I saw those conflicts as the worst thing that could have happened in my career. Today I see they were the best thing that ever happened to me professionally." "Why?" asked Richard. "Because they forced me to discover an inner strength I didn't know I had. They taught me about leadership, about forgiveness, about how to turn suffering into purpose." Michael agreed. "And for me, those conflicts saved me from continuing to be a person I didn't like. They forced me to confront my worst flaws and gave me the opportunity to become a better person." Richard smiled. "Do you know what my greatest lesson as a leader was in this process?" "What?" they both asked. "I learned that a leader's role isn't to avoid conflicts, but rather to create conditions for conflicts to turn into opportunities for growth." "How so?" asked Jennifer. "If I had simply fired Michael after that first incident, we would have lost an excellent doctor, and you wouldn't have had the opportunity to discover your capacity for leadership and transformation. And if I had transferred you to another department," Richard continued, We would have just masked the problem without really solving it. Michael reflected. So you created the conditions for us to find the solution ourselves. Exactly. I offered guidance, support, and most importantly, time for the transformation to happen naturally. The three fell silent for a few moments, each reflecting on the shared journey. Dr. Richard, said Jennifer, what is your vision for the future of our project? My vision is for you to continue expanding this work. We've already received invitations to open similar centers in other states across the United States and even in other countries in Latin America. Really? Asked Michael. Very real. In fact, I have a proposal to make to you both. What proposal? They both asked curiously. I would like you to consider creating a consulting firm specialized in hospital humanization. You would continue working here at Mercy General Hospital, but you would also serve other hospitals that want to implement our model. Jennifer and Michael exchanged glances, clearly interested in the idea. Dr. Richard, said Jennifer, would this proposal allow us to help even more professionals? Yes, and it would also allow our methodology to be adapted to different realities and contexts. Michael added, and we could develop new programs based on our growing experience. Exactly, confirmed Richard. You would have full autonomy to develop the project in the way you see best, with the hospital's institutional support. Jennifer and Michael spent the following weeks developing the business plan for Fresh Start Consulting, Healthcare Humanization. The company would focus on three main areas: interpersonal conflict mediation, training in humanized leadership, and implementation of wellness programs for healthcare professionals. 2 months later, the company was officially launched at an event at Mercy General Hospital itself. Several representatives from other hospitals were present, showing interest in the services offered. In its first year of operation, Fresh Start Consulting served 15 hospitals in 8 U.S. states. Each project was customized according to the specific needs of the institution, but always based on the principles of mutual respect, transparent communication, and joint growth. One of the most notable cases was at a hospital in Miami, where a conflict between the surgery team and the nursing team was seriously harming the quality of care. Jennifer and Michael spent 2 weeks in Miami, applying their mediation methodology. The result was so positive that the hospital implemented the program permanently and became a reference for humanization in the Southeast. Supervisor Wilson, Michael said during one of their work trips, do you realize how our story multiplies through the people we help? How so? Every professional who goes through our program takes what they've learned back to their team, who in turn influence other colleagues. It's a cascade effect of transformation. That's true. Sometimes I get messages from people I don't even know personally, but who were impacted by someone who participated in our trainings. That makes me think our story was just the beginning of something much bigger. 5 years after creating Fresh Start Consulting, Jennifer and Michael had directly impacted over 10,000 healthcare professionals across the United States. Their second book, Transformative Leadership in Healthcare, became required reading in several hospital management courses. Jennifer, now 38, had become one of the country's leading references in hospital humanization. Michael, at 42, was recognized as a specialist in workplace conflict mediation. But what made them most proud weren't the titles or recognition, but the messages they constantly received from professionals whose lives had been transformed by their programs. One such message, which arrived on a Thursday afternoon, particularly touched both their hearts. Dear Jennifer and Michael, my name is Amanda Johnson. I'm a nurse at a hospital in Denver. 2 years ago, I was about to give up my profession because of a conflict with a doctor on my team. I attended one of your workshops and learned about forgiveness and transformation. Today, that doctor and I are partners, and together we created a palliative care program that has already helped hundreds of families. Thank you for saving my career and for teaching me that it's possible to turn pain into purpose. Warmly, Amanda Johnson. Dr. Michael, Jennifer said after reading the message, messages like this remind me why we do this work. For me too, every time I read a testimony like this, I feel that our own painful journey was worth it. You know what moves me most about these messages? What? It's realizing that people not only applied our methodology, but went beyond it, creating their own solutions based on the principles we shared. That shows we planted seeds that keep growing even far from us. That same year, Jennifer and Michael were invited to give a TED Talk about conflict transformation. The video of the talk went viral, being watched by over 2 million people in 6 months. The title of the talk was "When Enemies Become Partners, The Science of Human Transformation," and it told their entire story in an inspiring and educational way. Comments from people all over the world started coming in. "This talk changed my perspective on workplace conflicts. Jennifer, a nurse from the US, I applied these principles in my hospital in Germany, and the results were incredible." Dr. Peter, a German doctor: "As a patient, I'm happy to know there are professionals like this in the world." Mary, a patient from Mexico: "The international success of the TED Talk opened doors for even bigger invitations." Jennifer and Michael were invited to teach courses at Harvard, Stanford, and Princeton universities, but they always made a point of returning regularly to Mercy General Hospital to maintain their roots and continue developing new projects with Richard. On one of these returns, a surprise was waiting for them. Mr. Harold, now 78 years old, was hospitalized again for a routine procedure. "My dear Jennifer, my dear Dr. Michael," he said joyfully upon seeing them. "Mr. Harold, what a joy to see you," Jennifer replied, giving the elderly man a warm hug. "You know I follow everything you do," he said. "My granddaughter shows me all the news articles about you on the internet." "You were one of the most important people at the beginning of our transformation," Michael said. "How so?" "You always believed in us, even when we didn't believe in ourselves. Your words of encouragement gave me strength to continue during the most difficult moments," explained Jennifer. "And you taught me that the patient's opinion is what really matters in our profession," added Michael. "You two fill me with pride," said Mr. Harold with tears in his eyes. "When I'm with my friends from the senior group, I always tell your story." "What story do you tell?" asked Jennifer curiously. "I tell them that I met two people who proved it's never too late to change, that forgiveness is stronger than anger, and that when good people come together, they can change the world." Mr. Harold's words deeply moved Jennifer and Michael. That night, after visiting other former patients, the two walked through the halls of Mercy General Hospital, remembering everything that had happened there. "Dr. Michael," said Jennifer, "sometimes I have the feeling that all of this was a dream." "Why?" "Because the transformation was so deep and so fast that it seems unreal, from sworn enemies to best friends and professional partners in just a few years. You know what I think made the difference?" "What?" "I think it was the combination of 3 factors: the wise leadership of Dr. Richard, your capacity to forgive, and my genuine willingness to change." "You're right. If any one of those elements had been missing, the story could have been completely different." The two stopped in front of the hallway where everything had started years ago. "Supervisor Wilson," said Michael, "may I ask a question that might be strange?" "Of course." "Have you ever wondered if we would be friends again if we met today for the first time, without all this history of conflict and transformation?" Jennifer thought for a few moments before answering. "Dr. Michael, I think our friendship is special, precisely because it was built through overcoming difficulties. If we met today, we would probably get along professionally, but we wouldn't have this deep connection that we have. I agree. Our flaws and qualities were revealed completely during the transformation process. Today, we know each other better than many people who have been friends for decades, and most importantly, we learned to value this friendship because we know how much it cost to build it." While they were talking, Richard appeared in the hallway. He still worked late, even after so many years. "Jennifer, Michael, what a surprise to find you here so late." "Dr. Richard, we were making a sentimental visit," said Jennifer. "To the place where it all began?" "Exactly," confirmed Michael. Richard joined them, looking at the hallway with affection. "Do you know that I also come here sometimes to reflect on everything that happened?" "Really?" asked Jennifer. "Yes. This hallway represents for me one of the greatest lessons of my career as a manager." "What lesson?" asked Michael. "I learned that moments of crisis are, in fact, the moments with the greatest potential for growth. If we avoided all conflict, we would never discover our capacity to overcome." "Dr. Richard," said Jennifer, "do you have any regrets about how you handled the whole situation?" Richard thought for a few moments before answering. "My only regret is not having implemented emotional support programs for the staff before the conflicts happened. Perhaps we could have avoided some of the initial suffering. But if you had avoided it," said Michael, "maybe we wouldn't have developed the entire methodology that now helps thousands of people." "That's true," agreed Richard. "Sometimes the most difficult path is the one that leads to the most valuable results." The three remained silent for a few minutes, each immersed in their own reflections. "Dr. Richard," said Jennifer, "what is your vision for the future of our work?" "My vision is that you continue to expand the impact, but without ever losing the human essence that makes this work special." "How so?" asked Michael. "As you grow professionally and gain recognition, there is a risk of becoming distant from the daily reality of hospitals. It's important that you stay connected with professionals who are living through real conflicts." "You are right," said Jennifer. "That's why we make a point of continuing to handle individual cases in addition to the large projects, and of coming back here regularly," added Michael, "to remind ourselves where we came from and why we started this work." Richard smiled with approval. "You have the wisdom that only comes from experience. That is what makes your work authentic and effective." 10 years after the first incident in the hallway, Jennifer and Michael organized a special event at Mercy General Hospital, the first international meeting of transformed professionals. The event brought together more than 500 healthcare professionals from 15 different countries, all with one thing in common: their professional lives had been transformed through programs based on the methodology developed by Jennifer and Michael. Richard gave the opening address. "Colleagues, today we celebrate something that is priceless: the human capacity to transform pain into purpose, conflict into partnership, and individualism into collaboration." For 3 days, professionals shared their stories of transformation. There were doctors who had overcome conflicts with nurses, nurses who had developed leadership in hostile environments, managers who had transformed toxic organizational cultures. One of the most moving stories was told by Dr. Carl Morris, a surgeon from Mexico. "5 years ago, I was known in my hospital as the most difficult doctor to work with. My outbursts of anger in the operating room were famous. When I learned about Jennifer and Michael's work, I initially resisted the idea of change. Today, my surgical team is considered the most collaborative in the hospital, and I discovered that being respectful doesn't make me less competent, but rather more effective." Another remarkable story came from Sarah Johnson, head nurse at a hospital in London. "In 2019, I was being bullied by a group of resident doctors. I was considering leaving nursing after a 15-year career. I participated in one of your online workshops and learned about assertiveness and forgiveness. Today, not only have I overcome that situation, but I have become a mentor to young nurses who go through similar difficulties." Jennifer and Michael listened to each story with emotion, realizing how their own challenges had multiplied into transformations around the world. On the last day of the event, they gave a special presentation on the 10 principles of sustainable transformation in healthcare environments. 1. Self-awareness. Recognize our own patterns of behavior. 2. Responsibility. Take ownership of our part in conflicts. 3. Empathy. Try to understand the other person's perspective. 4. Communication. Express needs clearly and respectfully. 5. Forgiveness. Release resentments that hinder growth. 6. Collaboration. Seek solutions that benefit everyone. 7. Continuous learning. See every challenge as an opportunity for growth. 8. Mutual support. Create support networks among colleagues. 9. Humanized leadership. Lead by example and with compassion. 10. Shared purpose. Always remember that we are all in the service of the patients. These 10 principles, said Jennifer, are not just theoretical concepts. They are lessons we learned in practice through much suffering and much joy. And the most important thing, added Michael, is that they work in any context, not just in hospitals. They are universal principles of human relationships. At the end of the event, the participants created an international network of transformed healthcare professionals, with the goal of continuing to share experiences and support one another. Jennifer was elected president of the network, and Michael took on the role of director of continuing education. 3 months after the event, the network already had more than 2,000 members in 25 countries. Local groups were forming in each region to hold regular meetings and develop collaborative projects. "Dr. Michael," said Jennifer during a video conference with the network's regional coordinators, "do you remember when we thought our story was just about the two of us?" "I remember perfectly. Today I see we were just the starting point of a much larger movement. And the most interesting thing is that every person who transforms becomes a multiplier of transformation." Exactly. We created a positive viral effect. That same week, they received a call that would change the course of their careers once again. The World Health Organization was inviting them to develop a global protocol for humanization for hospitals. "Jennifer and Michael," said Dr. Patricia Williams, the WHO representative, "you have developed the most effective methodology we know for transforming hospital environments. We would like you to adapt your model to be implemented in different cultures and socio-economic contexts." It was the highest recognition of the work they had developed. The project with the WHO took 2 years to complete. Jennifer and Michael traveled to more than 30 countries, studying different hospital cultures and adapting their methods for each reality. The Global Protocol for Healthcare Humanization was launched simultaneously in 50 countries and in 12 languages. At the launch ceremony held in Geneva, Switzerland, Jennifer and Michael were honored as global ambassadors for healthcare humanization. During her speech, Jennifer said, "When I was a young nurse crying in the bathroom of a hospital in New York City, I never imagined that pain would turn into a global movement of transformation. This teaches me that we never know the potential that exists within our greatest challenges." Michael added, "And when I was an arrogant doctor humiliating colleagues, I never thought I would discover my true calling by helping people overcome conflicts. This proves that it's never too late to start over and become a better version of ourselves." After the ceremony, the two walked through the streets of Geneva, reflecting on the extraordinary journey they had shared. "Jennifer," said Michael. They had stopped using formal titles a few years earlier. "If someone had told me our story 15 years ago, I would have said it was impossible." Why? Because the transformation was so deep and fast, from enemies to best friends, from a local problem to a global solution. "You know what amazes me the most about all this?" "What?" "It's that our friendship and partnership have continued to grow stronger over the years, even with all the success and recognition. I think that's because our partnership was born from something real and deep, not from convenience or self-interest, and because we never forgot where we came from and why we started. When they returned to the United States, they were received as national heroes. The President received them at the White House and created the National Hospital Humanization Program based on their work. But the most emotional moment was when they returned to Mercy General Hospital. Richard, now 67 and nearing retirement, organized a special reception. "Jennifer and Michael," he said at the ceremony, "you left this hospital as ambassadors of American humanization and return as leaders of a global movement. But to me, they remain the same dedicated professionals who transformed themselves through the courage to face their own flaws." The audience, composed of all the hospital's employees, applauded emotionally. "And now," continued Richard, "I have a special announcement to make." Everyone fell silent, waiting. "I have decided it is time for me to retire, and I would like to announce that Jennifer Wilson will be the new General Director of Mercy General Hospital." The auditorium erupted in applause. Jennifer was completely surprised by the announcement. "Dr. Richard," she said, visibly moved, "I didn't expect this." "Jennifer, you have demonstrated over the years all the qualities necessary to lead this institution: technical competence, humanized leadership, strategic vision, and most importantly, the ability to turn challenges into opportunities. And Michael," continued Richard, "I would like you to take on the role of medical director, working in partnership with Jennifer in the hospital's management." The two embraced, emotional about the new responsibility. "Dr. Richard," said Michael, "it will be an honor to continue your work." "No," corrected Richard, "the honor will be for you two to create something even better than what I managed to build." 6 months later, Jennifer officially assumed the directorship of Mercy General Hospital. Her first initiative was to create the Institute for Research in Humanization, dedicated to developing new methods for improving the healthcare work environment. Michael, as medical director, implemented an innovative collaborative medicine program where doctors and nurses made joint decisions about complex treatments. The results were extraordinary. Within a year, Mercy General Hospital became a global reference not only in humanization, but also in technical quality and patient satisfaction. The international magazine Healthcare Excellence placed the hospital among the top 10 in the world, especially highlighting the transformative organizational culture created by Jennifer and Michael. "Jennifer," Michael said during a board meeting, "do you realize we have come full circle?" "How so?" "We started as employees in conflict. We transformed into partners. We became global consultants, and now we are managers of the very place where it all began." "That's true, and the most interesting thing is that each phase prepared us for the next." "Exactly. The conflicts taught us about overcoming. The partnership taught us about collaboration. The global work taught us about adaptability, and now we can apply all of that to management." 2 years after taking over management, Jennifer and Michael decided to write their third book, Transformative Leadership: From Experience to Excellence. The book told not only their personal story, but also the practical methods they had developed for leading teams and organizations in a humanized way. One of the most striking passages in the book stated, "True leadership is not about avoiding conflicts, but about creating conditions for conflicts to transform into growth. The transformative leader is not one who never makes mistakes, but one who transforms their mistakes into learning for themselves and their team." The book became an international bestseller and was translated into 25 languages. During the launch tour, they visited 40 cities in 15 countries, always with the message that personal transformation is possible and can generate impacts that go far beyond the individual. During one of the lectures in Tokyo, a young doctor asked, "How do you maintain motivation after so many years working with the same theme?" Jennifer answered, "Every person we manage to help gives us renewed energy. When we receive a message from someone saying that our methodology saved their marriage, their career, or even their life, we remember why we do this." Michael added, "And besides that, we continue learning. Every new case, every new culture we encounter teaches us something different about human nature and the possibilities for transformation." But the most important thing, they both said together, is that we never forget we were once the people who needed help. That keeps us humble and connected to the reality of those who are suffering. 15 years after the first incident in the hallway of Mercy General Hospital, Jennifer and Michael organized a special event. 15 years of transformation, celebration, and reflections. The event brought together all the important people from their journey. Richard, already retired but still very active, Mrs. Barbara, also retired, Dr. Henry, now the director of a large hospital in Washington, D.C., and even Mr. Harold, now 85 years old, but still very sharp. "My dear Jennifer and Michael," said Mr. Harold during his speech at the event, "you two taught me that age doesn't matter when it comes to learning new things. At 70, when I met you, I learned about forgiveness. At 85, I'm still learning from you about never giving up on our dreams." Mrs. Barbara, moved, said, "I worked 30 years at this hospital and saw many beautiful stories, but none touched me as much as yours. You proved that the work environment can be a place for personal growth, not just professional." Richard gave the final speech of the event. "Jennifer and Michael, when you ask me what my greatest achievement was as a manager, I always answer, having created the conditions for you to discover your full potential. But today, I want to correct that answer. My greatest achievement was having had the wisdom not to give up on either of you during the most difficult times. It was believing that people can change when they have proper support and real opportunities." Richard's words moved everyone present. "And now," he continued, "seeing everything you have built together, I am sure I made the right decisions at that critical moment 15 years ago." At the end of the event, Jennifer and Michael made a surprising announcement. They were creating a non-profit foundation dedicated to offering their humanization programs free of charge to public hospitals in developing countries. "We want to ensure," said Jennifer, "that our methodology is available not just to those who can pay, but especially to those who need it most. We believe," Michael added, "that all healthcare professionals, regardless of their socio-economic status, deserve to work in respectful and collaborative environments." The Global Fresh Start Foundation was officially launched 6 months later, funded by the royalties from Jennifer and Michael's books, plus donations from hospitals and professionals who had benefited from their programs. In its first year, the foundation implemented free programs in public hospitals in the United States, Canada, Puerto Rico, Haiti, and Vietnam. The results were extraordinary. In each country, the programs were adapted to the local culture, but always maintaining the fundamental principles of respect, collaboration, and personal transformation. "Jennifer," Michael said during a visit to a public hospital in Hanoi, Vietnam, "do you realize how our story has completely transcended our original expectations?" "How so?" "When we were just two conflicting professionals in New York City, we never imagined we would be here on the other side of the world, helping Vietnamese doctors and nurses improve their relationships. That's true. This teaches me how small personal transformations can have global impacts when shared generously, and especially how our initial pain had a much greater purpose than we could have imagined at the time." During that trip to Vietnam, they met Dr. Roberts, a local surgeon who was going through similar difficulties to what Michael had faced years before. "Dr. Roberts," Michael said during an individual session, "I recognize in you many of my own behaviors from years ago." "How so?" asked the Bangladeshi doctor. "The arrogance, the impatience with colleagues, the tendency to humiliate others to feel superior. I have been exactly where you are now." "And how did you change?" Michael told his whole story, from the first conflicts with Jennifer to them becoming partners and friends. "The first thing I learned," he said, "is that my aggressive behavior was actually a result of my own fear and insecurity." Fear of what? Fear of not being good enough, fear of being questioned, fear of showing vulnerability. Dr. Roberts was silent for a few minutes, reflecting. "Dr. Michael, how can I start to change? I've already caused so much damage in my professional relationships." "The first thing is to recognize that you need to change. The fact that you are here asking this question is already a big step. The second thing is to ask for help. Transformation rarely happens alone. And the third is to be patient with yourself. Real change takes time and requires constant practice." 3 months later, Michael received an email from Dr. Roberts. "Dear Dr. Michael, I want to thank you for our conversation in Hanoi. I followed your advice and sought professional help. I also started applying the techniques you taught me. Yesterday, for the first time in years, I received praise from the nursing team for the respectful way I conducted a complex surgery. It's just the beginning, but I feel I am on the right path. Thank you for showing me that change is possible. With gratitude, Dr. Roberts." "Jennifer," Michael said, showing her the email, "messages like this remind me why all the work we do is worth it. And most importantly," Jennifer replied, "they remind us that our own journey continues to inspire individual transformations in people we haven't even met in person." 20 years after the first incident, Jennifer and Michael decided to do a deep reflection on everything they had lived through and built together. They met in the same hallway of Mercy General Hospital, where it had all begun, but now as directors of the institution and leaders of a global movement. "Michael," Jennifer said, "if we could go back in time and talk to ourselves from 20 years ago, what would you say?" Michael thought carefully before answering. "I would say to the Michael from 20 years ago, your arrogance is hiding your insecurity, and it is destroying not only your relationships, but also your own happiness. Have the courage to be vulnerable and to ask for help." "And you, what would you say to the Jennifer from 20 years ago?" "I would say, that pain you are feeling will transform into the most important purpose of your life. Don't give up on your dreams because of other people's behavior. You are stronger and more capable than you think. And what would you say to the two of us together? I would say, you will become the best friends and partners you could imagine. All that initial pain will be worth it when you see how many lives you can transform together. The two were silent for a few minutes, absorbing the magnitude of the journey they had shared. Michael, Jennifer said, what do you think is our greatest legacy? I think our greatest legacy is having proven that human transformation is possible, no matter how deep the conflicts or how ingrained the negative behaviors. I agree. And also having shown that forgiveness is not a sign of weakness, but of inner strength. And most importantly, Michael added, having demonstrated that two people willing to grow together can create something much greater than they could individually. At that moment, their phones rang simultaneously. It was a message from the current Secretary General of the UN, inviting them to lead a new global program for humanization, not just in hospitals, but in all work environments around the world. They looked at each other and smiled. Jennifer, are you ready for another adventure? With you as my partner, I'm always ready for any challenge. And so, the story of Jennifer Wilson and Michael Thompson continued to expand, proving that when two people have the courage to transform their conflicts into growth, there are no limits to the positive impact they can generate in the world. Their journey, which began with tears and humiliation in a hospital corridor, became a global example that human transformation is always possible as long as there is courage to change, wisdom to forgive, and determination to grow together. End of the story. Now tell me what you thought of this incredible story of overcoming and transformation. Do you believe Jennifer made the right decisions by forgiving Michael and giving him a second chance? And what do you think about people's capacity for change in professional environments? Share your opinion in the comments. We love reading your sincere reflections. Don't forget to leave your like to support us. And most importantly, subscribe to the channel so you don't miss other exciting stories of overcoming and personal growth.